line for the sake of practice and demo. We don't have to do that, but I would spray, okay, around. And so I'll just give this a nice little spray around. I don't have to go right on the patella because I'm not taping the actual patella. We would create a good amount of flexion. I've already pre-cut a couple C-strips. I think maybe I made it a smidge long. Okay, so we have one. How we're gonna do this. I'm gonna rip the edges and take off the middle so that my fingers are touching that. Okay, once they're in a nice amount of knee flexion, I'm gonna again just kind of eyeball where I think the patella is. So this is someone you think who needs a little bit of some medial support because you think there's some lateral tracking issues, there's some tightness and trigger points you've noted along the vastus lateralis, and you want to encourage the patella to go more medially. So I see it, I visualize it. I still think I'm going to be a little long, and I come around. Maybe I'm okay. So I stretched it about at least 50%. I maintained the stretch. I pushed into him to lay it down, and then my end pieces get laid down without any tension. And then I would give it a good rub, and then make sure we activate the glue that's underneath there. Okay, so I engaged it. You can feel that his patella right here is right in this line. So I've covered it, I've given it a little nudge, and then I laid down my edges, okay? And then he should be able to freely move, no problem, okay? So the second piece I'm gonna show you is, I'm gonna cut this one a little too. This is gonna be more for this anterior knee pain. Somebody who you've already treated the patella tendon, you're working on all their soft tissue, you're now gonna go in and start working on their neuromotor control and their strengthening, and maybe you just wanna support the tendon. So we would do the same thing. We're holding, we've got at least 50% of the stretch. If I know the inferior pole of the patella is right in here, this is the rest of the patellar tendon, so I want to aim right at it. I want to give it a little lift and a push, and then do you see how if I hug, I'm creating this nice tracking of this is where I need you to be, this is where I need you to be, and then we're catching this piece, and then again just kind of encouraging it to lay down, and then this piece encouraging it to lay down, and then the bulk of it though, that's what we were kind of treating, okay, in here. So I sort of did a combo tendon with a little bit of a wrap and a little bit of a wrap. I'm catching a little bit of the VMO right here, and then there's our easy patellar tendon slash fat pads are in here, just kind of unloading them, creating like a little shelf to hold that area to support it and unload it, so when he does activate, it doesn't go right to like that one spot that hurts, okay? So it's just a very general, easy tape. A lot of people can do this themselves, so that's why I like to use this. They can help do something about it, and then you would continue the treatment of whether it's fascial work, quad strengthening, etc. Okay, but really easy tape jobs. Okay.